So hi, this is Dr. Kayla Cook, and I'm Dr. Ron Miller of Pursuit Physical Therapy, and today we're going to talk about EDS, and that's Ehlers Danlos syndrome. We're going to talk about, what is it, what's the way to diagnose it, and what's the best way to treat it. Kayla is one of our specialists here, and she actually specializes in treating EDS patients. So we just wanted to create a quick video and kind of go over some of the basics to help you make a good decision on what are the next steps to treatment, diagnosis, and etc. So just to start off, what is EDS and what does it really entail?
So EDS is a genetic collagen disorder. So the collagen affects our skin, our joints, our ligaments, and our organs. And so there's different subsets, and we treat in here the classical and the hypermobile.
Okay, so are physicians going to be, if a patient has symptoms, how do they diagnose it? Is it something that they go to the physician to get diagnosed? Is it multiple tests? How do you diagnose EDS?
You have to go to your physician. There are multiple ways to diagnose. One is using a Brighton scale, and there is a point system. We can do that in the clinic, but we still recommend that you go to your physician. There's also genetic counseling and genetic testing that is done to have a further diagnosis.
Okay, so what are the symptoms of EDS then? What are some of the common ones that people could be experiencing, whether they're diagnosed or not? What are the general symptoms of having Ehlers Danlos syndrome?
So the number one basic one is that people are hypermobile, or as people refer to as double jointed. We see that in the joints. They may be prone to dislocations. The other thing that we see is they easily bruise, and they have cold hands to the touch. Their skin may be extra stretchy, and they're just more flexible than the normal person.
Okay, so then I guess after you have it, you've been diagnosed, you know the symptoms, what's the best way to treatment? What does evidence say is the best way to treat this?
The best way is a multidisciplinary approach. So going to PT to help strengthen and stabilize the joint, because that's all that we can really do. There is no cure for EDS. Working with a dietitian to help find foods that work best for you, getting you electrolytes into your system for energy, and then working with your physician or pain management.
Very perfect. So we've seen a couple of these patients too that, with that multidisciplinary approach, that they can get back to feeling good, stop having the myofascial pain, and can manage symptoms to a point where they can still enjoy their life. What in general is the success rate of treatment? Is it something that it's like they can get to enjoying life, enjoy activities, not have the myofascial pain? Is there some sort of medical management with like pain meds or muscle relaxers? Are most outcomes pretty good with PT and physician care?
Most are. It's a very hard thing to give an actual percentage because every case is very different. But usually with PT, with your other disciplinaries coming in, you will start to see that you are able to live more of a normal life.
Okay, perfect. So I hope this video helped you out. If you're dealing with problems with EDS, or if you have some more questions for us, you can always visit our website at pursuittherapy.com, or click the link below, or even shoot us a call or a text at 407-494-8835. I hope you enjoyed this video and it helps you make a good decision on your next steps.
And come see me.
Yeah.